Tuberculosis, also known as TB, is a bacterial infection that spreads primarily through your respiratory system. TB may also affect other parts of your body, such as your lymph nodes, kidneys, urinary tract, or bones. Tuberculosis is spread through the air from one person to another. When an individual with pulmonary tuberculosis disease coughs into the air, TB bacteria is expelled in the form of small water droplets. This bacteria can remain in the air for several hours, which makes it very easy for nearby individuals to inhale the bacteria. Once an individual has inhaled the droplets containing TB bacteria, the bacteria enters a person's trachea and then the alveolar sacs in the lungs. Following this, the bacteria begins to multiply. The immune system begins working and macrophages begin to encircle the infectious bacteria. Then, the body produces granuloma to stop spread the infection. The tuberculosis bacteria stays in the lungs. The body is protected from the disease by the presence of the granuloma. Most likely, 8 to 10 weeks later, the granuloma will begin to open. This is when the person will be infected with tuberculosis. The process to become infected with TB could happen immediately. It could take several years, or it could never occur. When the TB bacteria escapes from the granuloma, then starts destroying the lungs. This is called pulmonary TB. The disease is caused by the bacteria known as Tuberculosis, also known as Mycobacterium tuberculosis. The bacillus spreads slowly and thoroughly throughout the lungs, which causes the formation of the hard nodules. The tubercles then begin to break down the respiratory tissue and make cavities in the lung. In the beginning phases of TB, you will not feel sick or show any symptoms. However, with active TB, you may generate symptoms such as severe coughs, weight loss, fatigue, fever, night sweats, chills, chest pain, shortness of breath, and loss of appetite. Tuberculosis now annually causes more deaths worldwide than HIV/AIDS. In fact, TB is one of the most common infections in the world. In 2014, 9.6 million people were diagnosed with tuberculosis and 1.5 million died from the disease. There are many medications available for treatment. The exact drugs and length of the treatment depends on your age, overall health, possible drug resistance, the form of TB, latent or active, and the infection location on the body. If you have active TB disease, your doctor will give you several antibiotics to treat the infection and to help prevent resistant bacteria from emerging in your body. The most common regimen involves a combination of INH, Priftin, pyrazinamide, and ethambutol for 3 months, followed by INH and Priftin to complete 6 to 12 months. Because active TB disease can be fatal if left untreated, regular monitoring and treatment. Do not spend long periods of time in stuffy, enclosed rooms with anyone who has active TB until that person has been treated for at least 2 weeks. Use protective measures, such as face masks, if working in a facility that cares for people who have untreated TB. If you live with someone who has active TB, help and encourage the person to follow treatment instructions. As well, overall keeping a healthy, active lifestyle for a strong immune system.